UroPatient, tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient. I'm your host, Vic Senese. Hey, if you're new to the show or you're just joining us, be sure to like and subscribe. It helps us out if you do that. Also, if you're here today, great show. This is a question I hear over and over from patients. They worry about that catheter when they get it in. And the big thing I ask is, or question I get asked is, can this actually fall out? Well, the answer to that, the simple answer is probably yes, but rarely happens. So anyway, I thought I'd do an episode on that. So watch this. Welcome, everyone. Today, we're answering a very common and very important question patients ask. Can my catheter fall out? So by the end of this talk, you'll understand when it can happen, when it shouldn't, and what to do if it does. I'm your host, Vic Senese, and welcome to UroPatient. A Foley catheter is designed to stay in place, so once it's inserted, a small balloon inside the bladder is inflated with sterile water. That balloon is the key reason the catheter usually does not fall out on its own. And you can kind of see the picture of what that looks like. Now I'm going to do a little demo because I always like to show my own, but I've got a catheter here. I'm just disconnecting it from the bag to give us a little easier demonstration. Don't want to stick myself with that needle. So here's the catheter, and on the end here is this balloon. Now, of course, when it's first put in, that balloon is deflated. Once it's inserted, then water, and I'm using air just because I don't like to make a mess. But anyway, you can see how the catheter inflates. So kind of hold it here so the automatic lens thing doesn't change it. So there you can see that's inflated. Now that sits inside the bladder so it can't pull out. I've got some pictures to show you that. Now, one of the questions that people often ask or wonder about is how big should that balloon be? Now, the balloons come in different sizes. This happens to be a 16 French, which is the size of how wide it is, with a 10 cc balloon. Now, 10 cc's means you should be able to put 10 cc's, which is what this syringe is, into the balloon to fill it with something. Now, I can tell you that these balloons can hold a lot more than 10 cc's without ever exploding. So you can see I've got a lot more in there. And I've actually tested it, and I've been able to fill a 10 cc balloon up to 90 cc's before it broke. So, and it's different tolerances, but why shouldn't they do that? Well, what you can't really see probably too well here is the eyelets are right up here on the tip of the catheter. As the balloon starts to come up, it can actually obstruct those eyes. So it's very important that you don't put too much, your healthcare worker doesn't put too much into the balloon, because overfilling it, now you can see how much it backed away from those eyelets. So that's key. Now, one other thing that I want to mention is, again, I said this is a 10 cc balloon. They come in different sizes, 10 cc's, 30 cc's is the biggest one I've seen, but that balloon will hold 30 or 3 of these syringefuls. And why would you use a bigger balloon? Well, sometimes you need to make sure that it won't fall out. So you need a big balloon to prevent it from happening. And the harder you pull against the bigger balloon, obviously, the more difficult it is to dislodge. So somebody who's had a history of pulling these out accidentally sometimes may use a larger balloon. Generally, I don't. I think that the bigger the balloon is, the more uncomfortable the catheter can be, because that big balloon is sitting in your bladder and it can be triggering your bladder for something called spasms, which we'll talk about in a little bit here. So anyway, those are a couple of things I wanted to mention. Now, this is the headline answer. Can a catheter fall out? Well, under normal circumstances, a catheter should not fall out. If it does, something usually has happened, and that deserves attention. And as I put it here, the balloon could possibly deflate on its own. There's been, probably less than 1% of them, but in my career, I've seen some of these balloons deflate on their own. Not impossible. They could have a little tiny leak. If it's pulled hard, yeah, I've seen them get pulled out with the balloon inflated. That's not a good thing. So here's a picture of kind of what the balloon looks like if you could see inside. The balloon acts like a small anchor. Walking, sitting, normal movements won't cause it to fall out. You do not need to lie still all day long just because you have a catheter. So it's designed for movement. And even, 10 cc balloon will keep most catheters in place, so it's not an issue. There's things you can do to help prevent it from falling out. We're going to talk about those shortly, but as you can kind of see, that's how it's sitting in there. And those balloons, that above the balloon are those little holes that are draining the urine out. Now, sometimes the balloon can leak or breaks. I've seen it happen. Other times the catheter can be tugged accidentally, especially during sleep or when they transfer you from place to place, like getting out of a bed if you're needing assistance. Rarely, it may not have been positioned correctly. I've been called in a lot of times because somebody blew up the catheter inside of a man's prostate. They didn't get it into the bladder. Now, this is not something you can do anything about, except, make sure that you've got somebody who knows what they're doing when they put these catheters in. I've changed probably 1 million of them, so I'm pretty good at getting catheters in the right place, but I've seen enough that didn't get that way. So always go to somebody who's doing a lot of these, especially if they're having issues. Now, what should you watch out for? If you notice leaking around the catheter or suddenly feels loose, don't ignore it. These can sometimes be early signs that the balloon is no longer doing its job. Now, here's another key thing I'm going to talk to you about, though. A little bit of urine can leak around these catheters. That's from something called bladder spasms. Your bladder may not like the fact that it's got a foreign object in it, and it may react to that by squeezing. That squeeze could cause urine to leak around the catheter. So don't always assume that it's issue with the catheter falling out just because you see some urine leakage. I always tell patients kind of look at how much is hanging out of their penis or from their urethra. If you've noticed there's a lot more hanging out, that could be a key sign. Now, what do you do if it falls out? Well, don't try to put it in yourself. Never try to reinsert it. These are put in under what we call sterile condition, meaning we don't want to introduce any bacteria. Once it falls out, it's going to be contaminated. You don't want to put back a contaminated catheter. And especially unless you're specifically trained in how to put a catheter in, you may not know what you're doing. So call your nurse, call your doctor, or go to urgent care or the ER if that's what you're instructed. Get instructions on what to do. Most importantly, though, this is not an emergency. You don't have to rush or get right in. It's going to take your bladder about 6 hours to fill up. Now, I wouldn't waste a lot of time because if you can't urinate, and that's why you got a catheter in, why get to emergency room and then have to sit around for several hours waiting for someone to put the catheter in? So most of the time, not urgent, rarely anything dangerous. However, if you have severe pain, bleeding, say you pulled the catheter out with the balloon inflated, now you have a lot of bleeding, or you can't urinate at all, that does, as I say, start to make it more urgent situation. Again, whoever put the catheter in, call their office, find out what they want you to do. I can tell you that our service has somebody on, available 24 hours a day. They may end up sending you to emergency room depending on what time it is, or we'll just have you come into the office because we get pretty good coverage in the office. Now, can you prevent this from happening? Absolutely. And this is one of the biggest steps you can take. Use a leg strap or a securement device that prevents tension on the catheter, which protects both the balloon and your bladder. You don't want this thing having to be under tension where it's being pulled. So what you want to do is anchor it like you see on that picture there with a device. That happens to be one called Stat-Lock. There's a bunch of them out there. And I've even gone as simple as just taping the leg bag tubing, not the catheter. I don't like to put tape on a catheter. You can see that Stat-Lock does hold a catheter, but it's not sticky with tape. But something that secures it to the leg. And I've done some episodes on how to secure your catheter. So look back at those episodes if you want more information. But that's the key, wearing something that's going to keep it from getting tension on it. It's going to prevent an accident from happening most of the time. And as I said, there's lots of different products out there. There's a Stat-Lock. This is a different one that, again, a securement device. And as you can kind of see on that tubing that's coming out of the catheter, I've even just put tape around that. And again, I've got a video on how I tape that, so I'll let you look at that. Now, I was talking about special situations. Certain conditions like an enlarged prostate or bladder spasms may increase the risk of catheter movement. If this applies to you, extra attention and to securement is especially necessary. So as it kind of looking at that shocked up looking bladder, that's your bladder not being happy with the catheter in there, and it squeezes. That's what bladders do. So it squeezes, and that sudden squeeze could actually squeeze out a balloon if the balloon wasn't properly inflated, especially. But it's going to cause a little bit of leakage of urine around the catheter sometimes, which worries patients too. So when in doubt, call. We'd rather hear from you early than after a complication. So things like the catheter fell out, pain, bleeding, fever especially, or sometimes the catheter's in, but there's no urine. Now, I don't say watch your catheter so you see like every 15 minutes that there's urine coming through. I would say if you haven't seen urine filling up the bag for about an hour or two, you might want to start to get a little nervous that something's not working right. So let's wrap this all up. A Foley catheter is designed to stay in place. If it falls out, don't panic, but you do need to take action. Your healthcare team is there to help you keep you safe and comfortable. Now, how often does this happen? Well, I can tell you, 40 years in this business, I've had it happen. I've had catheters fail. Statistics out there say usually it's around 1% to 5%. I think 5 is pretty high, but a lot of different statistics out there. But about 1% probably isn't too unusual. Now, that means 1 out of every 100 could be unlucky. I've seen probably far less than that even in my own career, but again, I have seen it happen. It's higher risk in people that are confused or agitated, like dementia patients, because they could pull the catheter and not realize they're doing that. Poor balloon inflation. It should be inflated to the right amount specified on the catheter. Or balloon rupture. So too little, too much can be just as dangerous. Got to make sure whoever's doing it knows what they're doing. Traction on the tubing. Remember, that's why I said use that safety strap to keep that from happening. But especially when you're getting out of bed, transferring, treat it like gold. You don't want anybody pulling on that. Bladder spasms can sometimes cause balloons to get pushed out. Incorrect size. Now, that's not up to you to figure out. Your healthcare professional should know. And a lot of people think, the bigger the catheter, the better. That's not really true. You want to use the smallest catheter possible. Too small, it could block off, but too big, it can actually cause what we call erosion or, cause tissue to die from the pressure against the urethra. So your healthcare professional should know what the best catheter is. Different situations, I always pick different catheters. Most unintentional Foley dislodgements occur, believe it or not, in the hospitals and in long-term care settings. So usually at home, it's not the big issue. And this is a kind of an interesting fact, and I do agree with it. Most of these that fail in the first few days. So if you've got a defective catheter, it's probably going to fall out pretty quick. You're not going to, most of these catheters get changed on a routine basis every couple of months. And they last, but I can tell you that when we go to take the catheters out, I always deflate the balloon and see how much is in it. So that's one way to find out. So I hope all this was helpful, because I think that this is something that really bothers patients. They worry about that catheter, and knowledge is power. So the more you know about your catheter, the better. So join us again next week for more information on the UroPatient podcast. So there you have it. That's all you should need to know about that catheter and whether it could fall out or not. I do it a little differently. I pre-recorded these shows in the past, but now I'm actually on live. So if there's questions patients want to ask, feel free to put it in the comments. I'll be glad to answer those. I see a lot of people watching it live, so I'm really surprised because I pre-recorded everything in the past. But I'm trying to change things as I go along. Just to see how things, what might be the best way to do it. So anyway, if you ever have any questions, feel free to put them in the comments later on. I always look at those and answer those. So next week, join us. We're going to have a really nice, really good episode for you. We're going to talk about erections. There's a lot of misunderstanding about the physiology involved in it. And I thought, well, I should kind of straighten all that out for you guys. So join us next week to learn more, and we'll see you on UroPatient next week.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.